Hello everyone, my name is Daekook Nekar. I'm a research assistant in the Department of Physical Therapy at Sunman University. I'm really grateful today having this opportunity to share our research at this conference. Our research team, which is based at Sunman University in Korea, investigated the effects of augmented reality in physical activity performance and motivation. So the title of my presentation today is The Improvements of Physical Activity Performance and Motivation in Adult Men Through Augmented Reality Approach. The study was a randomized controlled trial. These are the contents of my presentation. So first we have the introduction, the methods, the result and discussion, and finally we have the conclusion. So let me begin with the introduction. The coronavirus pandemic, also known as the COVID-19 pandemic, has severely affected the economy, social interactions, and daily activities of people around the world. And during this pandemic, many countries use the lockdown or social distancing measures to prevent the spread of the virus. However, using this kind of action such as lockdown and social distancing measures cause anxiety and stress, and also affected negatively the population's daily routines, behavior, and physical activities. So if we compare this situation and before the pandemic situation, now most outdoor facilities such as fitness centers become empty or closed because people tend to avoid public and enclosed spaces. It also has been proved in a previous study that during this period of pandemic, maintaining a strong immune system is crucial, important to improve the ability to fight against the virus infection and limit the severity of the symptoms in case of infection. So in this particular situation, having an effective method to improve the immune system is really important. And physical activity is widely known for its benefit on health, and also many studies support this fact. Many previous studies reported that consistent physical activity is a key factor in reducing the risk of many persistent diseases associated with the risk of death. This is because physical exercise or physical activity operates as a regulator that significantly improves the immune system and also promotes a better quality of life. And in addition, a recent study revealed that physical activity is fundamental in reducing the risk of severe COVID-19 infection in individuals who are already infected. However, despite all the benefits of physical activity and all the positive impact of physical activity, the number of people with physical inactivity and those with sedentary life is still important, and physical inactivity is one of the serious health issues of the present century. So here we have a report published by the World Health Organization in 2020 on global physical inactivity. So as you can see here, 23% of male and 32% of female are considered to have a physical inactivity. And if we look at the Korean situation, a report published by the Ministry of Culture, Sport and Tourism on Korean level of physical activity, the result shows that the physical activity of Korean population decreased from 2019 to 2020, and the situation might continue to evaluate as the evolution of the corona pandemic. Due to the restricted outdoor mobility and accessibility of sport facilities, home training can be considered as a potential alternative solution to help people maintain normal fitness level and physical activity, and also to reduce psychological and social issues and all the other related issues. However, to have a continuous home training and expecting to have a good outcome, a continuous and adequate stimulation maintaining the level of interest in physical activity is important. And there are several theories on which feedback may have different effects on motivation according to how it's provided and how the individual understands those feedback. And for now, many types of feedback such as therapist-based feedback, mirror visual feedback, and innovative technologies using augmented reality or virtual reality-based training are being used in the rehabilitation and also in sport fields to improve performance. However, it remains unclear whether the augmented reality-based training is more effective than the therapist-based feedback and mirror visual feedback for improving physical activity performance and motivation during self-training or home training sessions. Therefore, the purpose of this research was to compare the effectiveness of augmented reality-based training on physical activity performance and motivation in recreational adults to mirror visual feedback training, conventional therapy, and a control group. So this study tends to highlight whether using augmented reality devices that provide real-time audio-visual feedback is more effective than feedback provided by a therapist or mirror visual feedback. The findings of this study would provide evidence on the effective method that can be used to improve physical activity performance and motivation during and after the COVID-19 pandemic. So now, let me explain the method that we used to conduct this research. First, the research was a randomized control trial, pre-test, post-test design conducted on adult males. The study procedure was conformed to the Declaration of Helsinki. It was approved by the Institutional Review Board of Sanmun University and was registered at the Clinical Research Information Service of Korea. For the sample size calculation, we used the software G-Power version 3.1, and we consider an effect size of 0.25 with an alpha level of 0.05, and we had 4 groups with 5 measurements. So based on those settings, we estimated a sample size of 48 respondents to have a 95% of power. So according to the G-Power sample size calculation, we recruited 48 men who were between 18 and 25 years old and engaged in recreational physical activities. So the inclusion criteria for this study was to be engaged in a moderate intensity aerobic physical activity at a minimum of 100 minutes per week, and also participated in muscle strengthening exercises at least once a week. And the exclusion criteria was including those who undergone treatment or surgery on the ankle, knee, or hip joints in the previous 6 months, those who had inflammation or degenerative joint disease, and also those who had mental illness or social problems. After the recruitment and the screening for eligibility, all the respondents who were included in the study were randomly allocated into 4 different groups by an independent investigator. So the first group was the ART group. This was those who performed the training while receiving a feedback through the augmented reality device. We had a TBT group, was those who performed the training while receiving a verbal feedback from a therapist, a physical therapist. We had a MVFT group. This was those who performed the training with a mirror visual feedback, and we also had a control group. So if you see down in the study flowchart, after the randomization, the respondents were allocated to the respective groups and they performed the training according to the different groups. And we didn't have a loss of follow-up. We didn't have a loss of a dropout during the whole process. And The data of all the respondents were collected and the statistical analysis were performed. So in table 1, you can see the general characteristic of the respondent according to each group with the age, height, and weight. In this study, we had 5 different outcomes. We had the muscle strength, muscle endurance, balance, flexibility, and motivation. So for the outcome measurement, first we used the isokinetic dynamometer to assess the muscle strength and muscle endurance. For the muscle strength, the respondents were instructed to perform 3 submaximal isokinetic contractions at the speed of 16 degrees per second between the range of 0 to 95 degrees, and we use the highest peak torque as the maximal isokinetic strength. For the muscle endurance, respondents were instructed to perform 15 maximal isokinetic knee flexion extension of the dominant leg with the knee range of motion set between 0 to 95 degrees. Next, we use the Y balance test to assess the balance ability, and the respondents were instructed to stand on the midpoint of the plate with the dominant leg and to push the yardstick as far as possible with the opposite leg. The best score in each direction was recorded and used for the data analysis. Next, we had the flexibility. So we used the sit and reach test to assess the muscle flexibility. First, the respondents were instructed to sit down with both legs straightened without shoes and with feet against the measurement box. They also were instructed to extend their arms on the measurement box and reach forward as far as possible with the knee extended. So the measurement was performed twice and the highest score was chosen for the data analysis. Finally, for the motivation, we use the 22-item intrinsic motivation inventory to assess the motivation level. So this scale consists of 4 subscales. We had the interest or enjoyment, the perceived choice, the perceived competence, and the pressure or tension. It is evaluated on a 7-point scale with a high score indicating a high level of motivation. So now let's look at the different type of intervention that were used in this study. First, we had the augmented reality-based training group. The respondent allocated in that group performed the exercises using the augmented reality device HyeYun Kang, manufactured in Korea, and the exercise protocol was directly programmed into the device, and the respondent followed the cadence of the audio-visual feedback provided through the device. So all the instructions, all the guides needed to perform the exercise was provided through the augmented reality device. We also had the therapist-based training group. So the respondent allocated in this group received instructions from the physical therapist, and they also received a real-time correctional verbal feedback on the ongoing exercise, and they also received an encouragement after each exercise that they perform. And we had the mirror visual feedback group. So the respondent allocated in this group performed the exercise in front of the whole body mirror, and they adjust the position, the posture, the ongoing exercise according to the reflected image that they see on the mirror. So they didn't receive any additional feedback from the therapist. And we also had a control group. So the respondent who were allocated in the control group, they performed the same exercise but without any feedback provided. For the statistical analysis, we use the SPSS version 25 for Windows, and we perform a descriptive statistic to analyze the general characteristic of respondents. We use the Shapiro-Wilk test to analyze the normal distribution of data. We perform the pair sample t-test to compare the differences between the pre-test and post-test within the groups, and the one-way ANOVA to compare the changes and the difference between the groups. We perform a post-hoc test using the Turkey test to analyze the changes between each groups, and we calculated the effect size using the mean score difference divided by the baseline standard deviation. And the effect size interpretation was as follows: small if d equals 0.2, medium if d equals 0.5, and large if d equals 0.8. All the significant level was set as p less than 0.05. Next is the result and discussion. So looking at the result, this figure presents the result of the knee extension and knee flexion muscle strength and muscle endurance. First, the knee extension and flexion strength along with muscle endurance showed a significant increase during the pre-test and post-test comparison in all the three feedback groups, despite we didn't have a significant difference between the pre-test and post-test in the control group. So looking at the between group comparison, first for the knee extension, muscle strength, and muscle endurance, we had a significant difference between the augmented reality based training group and the mirror visual feedback training group, a significant difference between the augmented reality based training group and the control group, and also significant difference between the therapist based training group and the control group. For the comparison, the between group comparison of the knee flexion, muscle strength, and muscle endurance, we had a significant difference between the augmented reality training group and the control group, and also a significant difference between the therapist-based training group and the control group. So the result reveals that a superior effect of augmented reality training group, respectively followed by the therapist-based training group and the mirror visual feedback training for improving muscle strength and muscle endurance. Next, we have another figure that shows the result of balance, flexibility, and motivation between the groups. Before that, let's look at the within group pre-test, post-test differences. For the balance, we had a significant improvement in all groups excepting the control group. For the flexibility, we didn't have significant difference in pre-test and post-test in all the groups. For motivation, we had significant increase from pre-test to post-test in the augmented reality-based training group, therapist-based training group, and the mirror visual feedback training group. Now, regarding the between group comparison, first for the balance, we had a significant difference between the augmented reality training group and the control group, between the therapist-based training group and the control group, between the augmented reality-based training group and the mirror visual feedback training group, and also between the therapist-based training group and the mirror visual feedback training group. For the between group comparison of the flexibility, we didn't have a significant difference between all the groups. And for the between group comparison of the motivation, we had an effect size that shows improvement in the following order. We had augmented reality training group superior to the mirror visual feedback training group, which was superior to therapist-based training group, and which was superior to the control group. So to briefly discuss the result that we found in our research, We all know that repetition of movement over time with sufficient load is very important to improve muscle strength and muscle endurance. However, improvement of flexibility requires to hold the same position for at least 10 seconds. And in our research, we found that flexibility didn't show any significant improvement in all the groups, regardless the type of the feedback. So this result may be explained by the fact that the respondent performed only one type of exercise, which was the squat, and we speculate that this was the reason why flexibility didn't show significant improvement. And in our research, we also found that performing physical exercise in front of a mirror had a minor effect on physical performance and motivation when you compare to the augmented reality or the therapist-based feedback. This can be caused by the fact that my mirror visual feedback doesn't provide a quantified data on the ongoing exercise and may limit the encouragement and motivation during the performance of the exercise. And we also found that feedback provided by the therapist was effective to improve motivation and physical performance. So we speculated that the presence of the therapist can allow psychological self-confidence and encouragement as a placebo effect. And when we compare to the feedback provided by the augmented reality device, the augmented reality device had a better outcome. So this can be explained by the fact that augmented reality can provide visual information to correct the position, to correct the movement during the exercise, and also quantified data on the accuracy of the task. So the respondent have a knowledge on the ongoing exercise, on the process, and also the data that was quantified. And a previous study conducted by Zhu and colleagues confirmed that knowing the results lead to a self-determination to do better than the last score, which stimulates the motivation. Also, self-determination may be the main reason for the superiority of augmented reality feedback in our study. So this explanation is supported by a previous study that affirmed that goal-oriented tasks and knowledge of the performance are fundamental factors for increasing interest and motivation for the ongoing task. However, the results found in this study should be interpreted carefully since this study had some limitations. First, the study only focused on the type of the feedback with only one exercise targeting the lower extremities, and the intervention was only conducted during 4 weeks without a follow-up to assess the long-term effects, and the result cannot be generalized since all the respondents were adult males. So further study is needed to evaluate the effects of diverse types of exercise in long term and provide more evidence on the topic. Despite all the limitations, the present study provides insights to effectively increase and maintain normal physical activity and motivation during this period of COVID-19. So to conclude this presentation, the present study aimed to compare the efficacy of augmented reality-based training on physical activity performance and motivation and compare it to mirror visual feedback training and conventional physical therapy. So with the findings of this study, we can suggest that using augmented reality training can be effective to improve physical activity performance and motivation. Moreover, using augmented reality for training can be used as an easier and better method for home training sessions during and after the COVID pandemic. Thank you very much for your attention.